All right. Hello, Mr. Loyd.
How are you today,
Great.
Scott?
Good to see you. Well, how are you doing?
Fantastic.
Awesome.
Really good.
Well, good. So we've got the cataract surgery done on your right eye.
On the right eye, yeah.
And we're getting ready to get the
The
left one
left
done.
eye, yeah, the 7th or the 5th, somewhere in that neighborhood.
Well, good. I would like for you, if you don't mind, to share with everybody your experience. Tell us about your cataract surgery and tell us the good, the bad, and the ugly. Was there any discomfort?
Absolutely none. It was amazing. The whole staff at the center here was fantastic. Okay, I came in, your technicians checked my eyes, set me up, you know, made measurements. I talked to you, I talked to another ophthalmologist that you have here on staff. Everybody was wonderful. And you arranged my surgery. I went in that day. They didn't even have to get undressed per se. In fact, I still had my shoes on when I was laying in bed.
Yeah.
And they gave me a couple of little blue pills, happy pills, little margaritas in a capsule.
That's right.
But anyway, I felt
civilized.
great, and you came in, talked to me a few minutes, and wheeled me in. And all I remember is watching you through the one eye that was open, because the other eye was closed. And I watched you use the laser. It's it's a light show. No pain, no discomfort, absolutely nothing. I felt nothing. It was more a visual light show. And then, of course, you told me later you wheeled me off to put in the actual replacement lens, and apparently they gave me a little stronger margarita, because I don't remember that part. But it did happen.
That's very common. I hear a lot. I would say that probably 80% of the people don't remember the surgical part where we remove your lens and put in the implant. So that's pretty.
I think I remember a little instance when you probably put the capsule in, and I saw it kind of expand like a flower. And I didn't know what it was, because I was kind of out of it. Which is the way you want me.
Right.
I wasn't thrashing around.
Well, good. And so that's good to hear, because, you know, as a surgeon, I try to prepare patients for what to expect with surgery. But having not had it done myself, I mean, I've done 40,000 plus, but it's great to hear from your own voice exactly what patients can expect.
I'll tell you this, I came in kind of apprehensive, because I had heard in the past that cataract surgery was very complicated, and it still is, I'm sure, from a technical standpoint. But with the modern capabilities that they have now, the equipment, the surgeons that have trained on this special equipment, it just, you don't even notice it. I walked out that day, no patches, no pain. Oh, my eye was watering a little bit. But that could be due to the stupid allergies here in the spring, you know?
And no needles, there were no needles, no injections. Your eye was numbed with drops, and which was great. And tell me then, with the vision, how did the vision go for you one day after the surgery and 1 week after the surgery?
Oh, fantastic.
Awesome.
I'm able to, I keep trying to pick my glasses up. And as soon as I put them on, I say, why does it all look bad? Take it off and lay them down. Use the one eye, well, I use both eyes, but I can read the chart. It's fantastic.
Beautiful.
I even was worried about close-up. But I can, about arm's length, I can read.
You can read, okay.
Even though I had conventional lenses, not the special lenses that you talked about, because of my medical condition, I couldn't have them.
You had the astigmatism correction, so good for distance vision, but you still have some
I can still, you know, I can read stuff like this easily. I can almost read this at the bottom here. So I'm going to have some magnifiers, or you know, Foster Grants. Okay, I probably should have said that. Some kind of magnifier. I'm going to go to my ophthalmologist, and
Dr. Richey.
Dr. Richey, and I'm going to ask him what magnifiers I might need for doing close-up work.
Beautiful.
And get the correct Doppler. Is that what they call it?
Diopter.
Diopter.
Yes.
Okay.
Yes. Beautiful. Well, Dr. Richey's great. So he'll
he is. He recommended you, and he recommended 3, and he said, "Well, I'd really go to Dr. Wade."
Well, appreciate that.
He kind of.
We get so many of our patients are sent to us from other eye doctors, and man, I've done their patients, their families, and I just appreciate their trust and our relationship, and they see the results as you have, and it's been a pleasure taking care of you.
It's been a pleasure having you for a doctor.
Awesome. All right.
I'll come back next time I have to have cataracts.
Perfect. All right.